Welcome to Bloom, everyone. I'm excited to talk to you today about the postpartum period. I'm so sad we can't be meeting in person today, and I know we're all looking forward to life getting back to normal. My name is Rebecca Rogers, and I'm an OBGYN with Vivi Women's Health. Today, I'm going to be talking you through normal and abnormal changes in the postpartum period. I'm currently 5 months postpartum with my second baby, and it is hard, especially with the isolation that has come with COVID. Hopefully, this talk will help you as you navigate this time as well. Pregnancy is filled with excitement as we prepare for baby. There is so much to get done and so much to focus on pregnancy wise that we don't spend much time before baby's born thinking about and preparing for the postpartum period. Our bodies are amazing, but they also change a lot after delivery. This includes both physical and emotional changes. You are recovering from delivering a child, either vaginally or after a C section, which both come with their own set of challenges to recover from. You are also adjusting to huge hormonal shifts, significantly less sleep than you're used to, and the responsibility of caring for a newborn. It is a lot to adjust to. It is so important to listen to your body. If you think something is wrong, let your doctor know. I always tell my patients not to suffer silently if there's something going on. First, I'm going to address some of the physical changes that you might notice after delivery. You might notice prior to delivery that your breasts start to leak. This is colostrum and it's normal. Colostrum is produced by your body first. It is a liquid that is high in nutrients and antibodies that help keep your baby hydrated and boost your baby's immune system. Milk production usually begins within 2 to 3 days postpartum, but it can take up to 5 days in some people. You might notice initially that your breasts feel engorged. That is the feeling of your breasts being very full and firm. This usually resolves spontaneously with feeding. It is important to feed frequently to minimize engorgement and prevent mastitis or a breast infection. Initially, feeding at least 10 times within 24 hours. Let your baby completely empty one side before switching to the other. If you develop a high grade fever, any areas of redness and tenderness on either breast, or if you feel like you have a flu, talk to your doctor. These are all signs of a possible breast infection. You can manage these symptoms at home usually for 24 hours with medications like ibuprofen and frequent breast emptying. But if your symptoms continue, you may need a course of antibiotics. So keep your doctor clued in to what's going on. Your uterus will return to its normal size 6 to 8 weeks after delivery. Do not be surprised when you still look pregnant after delivery. It will get better. You will continue to feel uterine contractions after delivery. This is normal. It's your body's way of getting your uterus back to its normal size. You may feel worse cramping when you breastfeed. This is in response to brain hormones released when you breastfeed, and it's also normal. Medicines like ibuprofen are usually the most beneficial for this pain. Your abdominal wall will slowly regain its tone over several weeks after delivery. You may notice an outpouching in the middle of your abdomen called diastasis recti. This is separation of your muscles from pregnancy, and it will generally improve with time. Your doctor may recommend physical therapy for severe symptoms. This condition is not dangerous, and only very rarely does it require surgical repair. If you have a cesarean section, it is normal to feel itching, burning, and numbness around your incision as the incision heals. You may also notice some clear fluid leaking out of your incision. Your doctor will want to know if you notice redness surrounding your incision, if you develop any fevers, if you notice a gap in your incision, or if you have thick, colored, or foul smelling or bloody fluid leaking from your incision. Leg swelling is also a common problem after delivery. You had a lot of extra blood and fluid in your blood vessels during pregnancy that tends to leak out and cause swelling after you deliver. This should improve over the first 2 weeks after delivery. You may have also noticed dark blue raised blood vessels on your legs and even your vulva during pregnancy. These are called varicosities. These veins usually lighten and disappear with time. Your doctor needs to know if one of your legs is more swollen than the other, if you are having pain in your calves or anywhere else in your legs, or if you develop redness of your legs. These can all be symptoms of a blood clot deeper in the veins of your legs that could be very dangerous. This image depicts how I currently feel. Hair loss is very common for the first 6 months postpartum and will usually peak between 4 and 6 months. Unfortunately, no studies have found a magic cure for this hair loss. Be reassured that it's normal and it will improve over time. If you feel like your hair loss is continuing longer than expected, or if your hair loss is severe, talk to your doctor about it. Sometimes hair loss can be worsened by low blood counts or issues with your thyroid that can be checked with laboratory studies. You may notice lots of changes to your pelvic floor after delivery. After a vaginal delivery, swelling, lacerations, or tears to your vagina, vulva, and perineum are common. These can cause burning with urination, and your postpartum nurse will provide you with lots of supplies to help ease this discomfort. This will include things like ice packs, a spray bottle, witch hazel pads, and numbing spray. Use them if you need them. Lochia is a term for normal bleeding and discharge after delivery. It is your uterus's way to clear itself out. It can last up to 6 to 8 weeks after delivery. This discharge can have an odor. Your doctor will want to know if you are soaking through more than 2 pads in an hour. Your bleeding should overall continue to lighten after delivery. You may notice that you have a gush of bleeding or pass a blood clot, particularly if you've been laying down for a long time, but that bleeding should ease after you get up and go to the bathroom. Let your doctor know if you're still having continued bleeding at your 6-week postpartum visit. If you're breastfeeding, you may notice vaginal dryness after delivery. Breastfeeding suppresses your normal estrogen production and can cause menopausal symptoms. Talk to your doctor if your symptoms are bothersome. Many women experience urinary incontinence during pregnancy and after delivery. This resolves in almost everyone by 6 months. Let your doctor know if this is an issue you are having, but be reassured that it will likely get better on its own. You may also notice a vaginal bulge after delivery, which is a symptom of prolapse. This also frequently improves after delivery, but sometimes requires pelvic floor physical therapy or a consultation with a specialist, so make sure you're keeping your doctor in the know. Always let your doctor know if you're having fevers after delivery, as these can be a sign of a breast or pelvic infection. You will immediately lose an average of 13 pounds at the time of delivery. As your uterus returns to its normal size over the following 6 to 8 weeks, you will likely lose another 5 to 15 pounds. In general, people tend to lose about half of their pregnancy weight in the first 6 weeks after delivery, and the remainder of your pregnancy weight is lost over the following 6 months. This is very person specific and also depends on how much weight you gain during pregnancy. Some people find breastfeeding helps accelerate weight loss, while others find that they have to increase their caloric intake to support their milk supply and struggle to lose weight during that time frame. Emotional changes are common after delivery. Postpartum blues describe mood changes that happen in the first couple of weeks after delivery as you adjust to your new normal and can have associated irritability, mood swings, difficulty with sleep, and exhaustion. These symptoms tend to get better over time. Postpartum depression is seen in at least 5 to 25% of patients postpartum, and it can be helped with things like medication, counseling, and support groups. Let your doctor know if you're frequently feeling tearful, down, guilt ridden, anxious, if you're having difficulty concentrating, if you're unable to sleep or feel like you're sleeping all the time, if you're feeling withdrawn from your support system, or if you feel like you're having difficulty bonding with your baby. Do not wait for your 6-week postpartum visit to address these feelings with your doctor. Always let your doctor know if you're having any thoughts of hurting yourself or someone else. Again, do not suffer silently. We need to know what's going on in order to help you. Next, I'm going to talk about your postpartum visit. In general, you'll be seen at 6 weeks after a vaginal delivery and at 2 weeks and 6 weeks after a cesarean section, though this varies by doctor. At this visit, you will discuss with your doctor how you're feeding your baby and if you're having any issues with feeding, how your emotional health is, what your plan is for birth control, and if you're having any physical issues like continued pain or bleeding, incontinence, or any other body issues. Your doctor will review any chronic medical conditions you have, like high blood pressure, thyroid disease, and how you're treating those issues. Finally, this is a great opportunity to review healthy eating habits, dietary recommendations, and safe exercise habits postpartum. Your doctor will review all of your postpartum contraception options for you. It's important to select the method best suited to fit your personal needs. Pregnancy should be avoided for at least 6 months after delivery and ideally for 18 months to allow your body to completely heal from delivery. You and your doctor will review what you're looking for in contraceptive options and find the best method for you. Next, I'm just going to review some postpartum pearls. Pearl number one is make yourself a priority. It's easy to lose sight of taking care of yourself when you're caring for your newborn. Do not ignore yourself. Make sure you stay hydrated. Take medication as needed for your pain. Keep taking your prenatal vitamin. Try to rest. You've probably heard someone say, sleep while your baby sleeps. And while this is a great goal, know that that's also going to be the free time you have to do things like take a shower, do your laundry, because there will be lots of it, eat, and all of the other things on your to-do list. It's all a balance. Try to eat small, healthy snacks and meals throughout the day. Pay attention to the physical changes we discussed and let your doctor know if anything seems abnormal. In terms of your postpartum diet, you and your doctor can discuss weight loss goals depending on your baseline body mass index and activity level. It is helpful to have your fridge and pantry stocked with healthy snacks that you can grab and eat easily and quickly. You need to be able to stay hydrated, especially if you're breastfeeding. You also have to watch caloric restriction while you're breastfeeding, as too few calories may lead to a decrease in supply for some people. If you're breastfeeding, you want to continue taking your prenatal vitamin daily to boost the amount of vitamins in your breast milk. You want to make sure that you maintain a diet high in protein. Foods like fish have added protein and DHA, which are great for your baby, but you do want to avoid fish with high mercury content, such as swordfish and tuna, as mercury can accumulate in your breast milk. If you're on a special diet, like a vegan diet, you want to discuss this with your doctor to make sure that there's no additional vitamin supplementation that you need to add. You can treat yourself to a beer or a glass of wine, even if you're breastfeeding. To decrease the amount of alcohol in your breast milk, you can feed or pump while you're having a glass of wine, and you can wait 2 to 3 hours after drinking as your body metabolizes the alcohol in your bloodstream, which will decrease the amount of alcohol in your breast milk. Do not feed your baby if you're intoxicated, and never co-sleep if you've been drinking alcohol. It's safe to drink 2 to 3 cups of coffee a day, even if you're breastfeeding. Treat yourself, you'll probably need it. Talk to your OBGYN about when you can start exercising again after delivery. This will depend on multiple factors, including how you were delivered and any complications you might have had at the end of your pregnancy. Once cleared, ideally you will exercise at least 150 minutes of moderate intensity exercise per week. Taking your babies on walks is a great way to get outside, increase your activity level, and keep your baby entertained. Again, make sure to stay hydrated as you increase your activity level. Cherish your time postpartum. Know that there will be times that are hard, but babies grow up so fast. Enjoy all those little baby cuddles. Ask those around you for help when you need it. As much as we want, sometimes we can't do it all. Let people know if they're overstepping their boundaries. We are all learning on the fly. It's okay if you feel clueless. You are learning something completely new and hard. Trust your instincts. If something doesn't seem right, bring it up. Give yourself grace. You grew a human and you're now learning how to raise a human. Finally, get out of the house. This is harder now with COVID, but it's so important to break up the monotony of newborn life. Fresh air is so good for the soul. In terms of a postpartum checklist, the hospital will provide you with pain medication, pads, ice packs and heat packs, witch hazel pads, and squirt bottles. Get some comfy cotton underwear that are big enough for your pads and you don't care if they get ruined. If you're breastfeeding or pumping, you will want to have nursing bras for easier access and nursing pads to help soak up leaking milk. Lanolin ointment can help soothe sore and chapped nipples. Stool softeners are your friend. Hemorrhoids are incredibly common postpartum, and the best fix is fixing constipation. Belly bands or belly belts are safe postpartum and help some people feel more confident, but they are not medically necessary. And always keep your water bottle by your side. Again, if you ever have any questions and don't know where to go for help, your OBGYN is always available to help guide you through this very hard but amazing time in your life. Thank you so much for listening today, and I hope you've learned something that will make your transition into the postpartum period a little bit easier. My partners and I at Vivi are so proud to be a sponsor of Bloom, and we are always here if there's anything that you need. You can learn more about our practice at vivifw.com.